Hi, I'm Dr. Chase, a family physician in Ottawa with a focused practice in obstetrics and gynecology. I'm here to answer some of the most common questions I get about sexually transmitted infections, otherwise known as STIs. Let's get started. How common are STIs, and should I really be worried about them? STIs are more common than you might think. In Canada, rates are rising across many provinces and territories, with millions of people affected each year. Some of the most common infections include chlamydia, gonorrhea, syphilis, HPV, and herpes. STIs are part of a broader group called sexually transmitted and bloodborne infections, often shortened to STBBIs, which also includes HIV, hepatitis B, and hepatitis C, spread through blood as well as sexual contact. It's important to be aware and take steps to prevent STIs, as untreated infections can lead to serious health problems. The good news? Most STIs are preventable, manageable, and often curable if you get tested and start treatment early. Practicing safer sex is key to protecting yourself and your partners. Can I have an STI without symptoms? Absolutely. Many STIs, like chlamydia, gonorrhea, and syphilis, don't cause noticeable symptoms. That's why regular testing is so important. It's the only way to know for sure. How often should I get tested? It depends on your situation, but a good rule of thumb is before starting a new sexual relationship, at least once a year if you're sexually active, more often if you have multiple partners or engage in higher risk activities, such as inconsistent use of condoms or other barrier methods, having sex while under the influence of drugs or alcohol, being involved in sex work or having a partner who is, using or sharing needles for drugs, tattoos, or piercings. Remember, you can get tested even if you feel fine. Many STIs don't show symptoms, especially at the beginning. Where can I go to get tested? There are many places across Canada where you can get a free and confidential STI test, including the doctor's office, community health centers, university or college student health clinics, or walk-in clinics. A nurse practitioner or doctor can offer STI testing or provide a requisition form for an STI test. You may be able to access STI testing online through services like Get Checked Online or Get a Kit, or through other virtual programs. In some areas, testing is also available at specialized clinics, often without an appointment, or at local pharmacies. Visit Action Canada or Katie's website for more options near you. Why is it important to find out as soon as possible whether you have an STI? Knowing you have an STI early can save you a lot of trouble. If left untreated, STIs can cause infertility, weaken the immune system, increase the risk of passing the infection to others, cause pelvic infections, lead to complications during pregnancy like miscarriage or health issues for infants. The earlier you test, the easier it is to treat and manage. How can I protect myself from contracting an STI or reduce my risk? You can protect yourself and your partners by getting tested regularly, especially if you might be having sex without using protection all the time. Also, using condoms or dental dams during oral, vaginal, and anal sex. Getting vaccinated for HPV and hepatitis B. Having open, honest conversations about sexual health with your partners. You can communicate what protection feels right for you, as the decision is always yours to make. Talking to a health professional about HIV prevention options like PrEP, pre-exposure prophylaxis, or PEP, post-exposure prophylaxis. PrEP is taken before possible exposure to reduce the risk of getting HIV, while PEP is taken after a possible exposure to lower the chance of infection. A health professional can help you decide what's best for you. Talking about sexual health can sometimes be awkward. Do you have any tips? Conversations about sexual health can feel a little awkward at first, but they're so important. These discussions are about care, respect, and keeping everyone healthy. Here's how to make it easier. Start gently. Try asking, how do you feel about using condoms or dental dams? Or, would you want to get tested together? Asking questions keeps it open and inviting. Keep it positive. Say something like, I want us all to feel good, healthy, and confident. What can we do to make that happen? Framing it as a shared effort makes it less intimidating. Pick the right moment. Choose a relaxed private time when everyone feels comfortable. It could be before intimacy, during a casual hangout, or even over text if that feels easier. Be kind and non-judgmental. Everyone has different experiences, comfort levels, and dynamics. If someone shares something personal, listen with care and without judgment. Focus on mutual respect. These conversations are about creating a safe space where everyone involved can share openly, set boundaries, and decide what works best for them. It's okay if the conversation doesn't feel perfect right away. What matters is showing care for everyone involved and taking steps towards open, honest communication. That's what builds trust and keeps everyone safe and healthy. So just remember, sexual health is an important part of your overall health. It's just as essential as taking care of your physical or mental well-being. Unfortunately, it's often overlooked or feels uncomfortable to talk about because of outdated taboos. But here's the truth. Sexual health is completely normal. It impacts everyone, and the more you know, the more empowered you'll be to make choices that are right for you and your relationships. It's all about being informed and feeling confident and supported. We touched on a few key things, but if you want to dive deeper, head to canada.ca/STI for more info, helpful resources, and testing locations near you.